Welcome back to Startup Health Now. I'm Logan Plaster. Today, we're talking about gamification in healthcare. Gamification has been a popular buzzword in tech and in health, but it just means using elements we associate with games in non-game contexts. In healthcare, it means capitalizing on the motivations we find in games through things like progress updates and level up badges to change behaviors and get us to do things that are going to be good for our health in the long run.
Eddie talks to the user, tells them stories, plays games with them, and that way we make it more relatable and more enjoyable to manage your diabetes.
Today on the show, we're talking to two founders who are gamifying the healthcare experience in two unique ways. The first conversation is with Raj Amin, co-founder and CEO at Arcade Therapeutics. He's got an interesting way of describing what they're building.
Yeah, so we're really a science-first game studio.
Okay.
Developing games
I like
that really...
that. That sounds good.
Thank you. Developing games that act like medicine.
You'll hear exactly what they're building and why clinical research is key to their approach. After Raj, we'll hear an interview with Farhana Ahmadi, co-founder and CEO at Eddie. Eddie is part of our T1D Moonshot, and she and her team are using mobile gaming elements to help young people better manage their diabetes. The idea came from her personal experience being diagnosed with type 1 diabetes while getting her PhD.
I felt lonely a lot of the times when dealing with a lot of aspects of my type 1 diabetes, and I always wished that there were a character that I could talk to, something that would bring a little more delight into the day, and that is how the character Eddie and later on the company was formed.
You'll hear more about Eddie, the friendly leaf avatar that makes T1D care a bit more fun. But first, let's jump into our conversation with Raj Amin, CEO and co-founder at Arcade Therapeutics. I recorded this interview at HLTH in Las Vegas. You are taking a new spin on mental health, bringing people a new kind of care that's hyper accessible. So Tell me what you're building.
Yeah, so we're really a science-first game studio.
Okay.
Developing games
I like
that really...
that sounds good.
Thank you. Developing games that act like medicine, really.
Okay.
I mean, our goal is really to reduce the time for people to get engaged with mental health treatment by using a modality that they already use today in everyday life, which is gaming.
Mobile games.
But these are games that are going through rigorous testing. As a science-first game studio, we really are looking at the evidence the way that you look at evidence for medicine. So we are moving through FDA clearance on a number of products, and that's what we mean by science-first.
How novel is that concept? How differentiated is a science-first gaming studio?
Yeah, I mean, we think it's highly differentiated.
Yeah.
You usually don't get sort of game developers together with real scientists.
Yeah, I didn't think so.
To create games that have the same effect as medicine, and so that sort of combination of DNA and skill sets with my co-founder, Dr. Tracy Dennis-Tewari, who's an NIH-funded scientist, along with my experience in consumer products, comes together. And
yeah, I thought you were going to say combining Dr. Dennis-Tewari's experience with yours playing Candy Crush, but obviously you've got deep business development experience.
Yeah, business development and consumer products. I did spend about 10 years in the television industry.
Okay.
Before all this, so.
I want to hear about the games themselves, because anyone watching this is gonna say, wait, how can a mobile game be something that a doctor prescribes and helps me? So break it down.
Yeah, so our games are embedded with a certain type of cognitive retraining technology that's called attention bias modification training. Okay. And it really has to do with faces, because we can perceive faces even when you're a baby. You know whether your mother is smiling or not, right? So we use facial archetypes in order to retrain your attention away from negative stimuli towards positive. So you can almost train away from anger towards joy using this technique by repeatedly driving attention towards the positive faces. And that's all, wrapped within a game, so you really don't even know you're doing it.
Okay.
And so...
what's the gameplay like?
So the gameplay is, it's a space game. Our game, Star Starter RX, which is you're saving a planet which has been disturbed by a negative force. And the way you do that is by kind of moving a ship by flicking it across a game board to collect star energy, which lights up stars in the constellation, lights your path to the planet, and you save the planet, you save the universe over 30 days. So you can almost think about it like an active meditation, where you're taking 12 minutes in a day, and you're playing the game, and you play the game 4 days a week for 30 days. And through our FDA pilot trial, which we completed at the end of the first quarter, we were able to, after the 30-day treatment, 68% of the test patients dropped to full severity level in their social anxiety scores.
Really?
38% dropped to subclinical levels, and overall 90% of patients had reductions in symptom severity of an average of 33%.
Because they were retraining their brain to choose the positive? Sort of break it down at a
essentially,
simple
like,
level.
this is about something called threat bias.
Interesting.
And this is a natural
subconscious.
propensity we have subconsciously to take in more negative information than may exist in a situation. So we look towards the threat. And so by playing the game, we're essentially shifting your bias back to neutral, so that you see the world as it is and you see the positive paths that there are for you. What it does, biologically, is you're actually just reducing the impact of things that might cause anxiety for you.
Interesting.
And so we do that over a 30-day period.
Fascinating. Now, because we've met before and I've written about your company, I've gotten to read about bias modification, interesting.
Attention bias
modification, and fascinating sort of scientific background. But there's a part of my brain that's thinking about the viewer who's thinking about mobile games and thinking about the way that they train the brain in negative ways. So I wonder if you can comment on people's fears of training your brain towards shorter attention span, dopamine hits, all this sort of the negative side.
Yeah, so I would probably defer that question to the scientist on my team.
Yeah.
But what I will say is that we're very conscious of getting people off of screens.
Yeah.
And so there's actually a 12-minute time limit.
Got it.
And you can only play the game once a day.
Got it. Okay.
And this 4 days a week. You can't overplay the game.
Okay.
And so you can only pause for 4 minutes when you play. So you're really meant to sit down, play the game, then get back out in the world and kind of enjoy your life and get into real social situations.
So part of digital therapeutics is to limit the digital side.
Yeah, absolutely.
Yeah.
I mean, there's no replacement for human connection.
Yeah.
Right? So we want to emphasize that, but we can help people to be more open to that human connection, and that's really what excites us.
Well, it's clearly resonating because you recently got $3.8 million from the National Institute of Mental Health.
Yeah, it's the first time that a software company has received this type of grant, which is an R01 grant, which we were able to get in partnership with our colleagues at UT Austin.
That's awesome.
And that is specifically to fund the clinical trial for our upcoming depression product.
Okay.
Which will come following our anxiety
That's a
product.
new game?
That's a new game.
Okay.
With slightly different algorithms around the training mechanism that is optimized for depression. Although even with the anxiety product, we were able to move depression endpoints measured by the Beck's depression inventory. But this new product will be specifically optimized for depression. So we're really excited because we could conceivably, in a very short period of time, have two products FDA cleared for anxiety and depression, which are the largest prevalence for mental health conditions.
Talk to me about the importance of lowering the barriers to care. You think about people with mild or new anxiety and depression, and what it takes to really get somebody in front of a professional.
Well, this is one of the largest barriers today to getting people treatment is the lack of providers, and so that's one big part of it.
Before you even start talking about the stigma.
Before the stigma or the desire for self-care, right?
That's right.
Like 50% of people who are diagnosed with a mental health condition actually won't even seek treatment. And so if you think about that, there's a huge gap in the marketplace to give people tools that are clinically validated, that they can use on their own time, that really align with self-care and, to your point, are low stigma. And that's really where we're targeting. Although we certainly can be used in combination with CBT type programs, because we're not conflicting with what a provider may be trying to do with CBT, because we're a subconscious cognitive training mechanism.
Yeah.
So it can be complementary as well. But really, we think there's a huge opportunity, even as you look at primary care, to get to people earlier with a low stigma treatment before they even, or while they're kind of waiting to
It's
be
something
seen.
you can just try, right?
You can just try.
Yeah, give this a shot.
And we're
Might
getting,
help.
amazing results. The emails that come into our site are now starting to come from the spouses
Really?
of the people who are using it.
Like, give me an
I had an
example.
email came in the other day where a man was saying that his wife was smiling so much he thought it could help him. And so you think about what it takes
Wow.
for
From a pretty simple game.
the game
Simple
having
interface,
having
simple-
impact.
But there's this layer, this science-based layer beneath it. It's really quite amazing. Last question: do you feel like this? That you said the grant from the NIMH was the first such to a software company. Do you see a sea change happening? Like more of a desire to see digital therapeutics and game-based therapies get funded?
Yeah, absolutely. In fact, you may know that there's legislation moving through Congress right now, the Access to Prescription Digital Therapeutics Act, which is getting a lot of support, bipartisan support, and I think, and there's certainly a recognition that we have to have new tools available. We have to have tools that don't require, as much human intervention to solve this massive mental health challenge that we have today. And so that will include software-based therapeutics that are validated and easily integrated into healthcare protocols today. So, definitely the funding side with grant funding is fantastic to be able to support the clinical trial process for products like this, but also, legislation. So certainly contact your representatives out there to support this Access to PDT Act that groups like the DTA have been supporting, because that's really what it's going to take to allow reimbursement to follow the availability of these treatments.
Very nice. Raj, it's exciting progress. I really love what you're doing.
Appreciate
It's
that.
fascinating to have a science-based gaming studio, and I think the sky's the limit. So keep up the good work.
Thank you.
All right, take care. That was Raj Amin from Arcade Therapeutics. Next up, we'll hear my conversation with Farhana Ahmadi, co-founder of Eddie. Their platform is gamifying care for type 1 diabetes with an eye towards helping young people manage the disease better. Farhana, great to see you.
Lovely to see you as well. It's a pleasure to be here.
It has been interesting to learn about your journey, learn how you have built this app that helps folks with type 1 diabetes. I understand it really came out of a personal journey, like so many founders in healthcare. I wonder if you can share a bit of that.
Yes, so as you know, I live with T1D myself. I've been living with it for over 10 years now. So it was definitely a very personal journey to me. It was actually at a very critical time when I was diagnosed. It was the first year of my PhD. I had so much going on, but I wasn't feeling great, and I had to deal with a lot. I felt lonely a lot of the times. When dealing with a lot of aspects of my type 1 diabetes, and I always wished that there were a character that I could talk to, something that would bring a little more delight into the day, and that is how the character Eddie and later on the company was formed.
Okay, so a character that brings a bit of delight, a bit of levity. So describe what that is in the app.
Absolutely. So on the outside, Eddie is a leaf. A character. It's very child-friendly, yet it's a very smart character. It responds to real-time glucose data.
Okay.
Right now we get that from Dexcom. And it's very dynamic, and over time it gets to know the user better. It asks the user how they're feeling multiple times a day.
Okay.
It links their blood sugar to how they're feeling. For example, it tries to identify whether that is because of their blood sugar or not. And we've built in so many other smart features into the app. Whether it's a chatbot, Eddie talks to the user, tells them stories, plays games with them.
Okay.
And that way we make it more relatable and more enjoyable to manage your diabetes.
You're primarily targeting children, adolescents, or is this for anybody?
We primarily target children and their families. However, half of our users are currently adults. We are very excited, yet surprised by that, and we are looking to see whether we can launch a product for the adult population as well.
It doesn't shock me. Everybody wants something to be friendly and fun.
We are all big kids, right?
Yeah.
We want to play around and have fun all the time.
Yeah. What are some of the specific features that you're excited to share with patients?
So, in addition to the gamification, we actually offer users real-life rewards, which we have coming very soon. So if you're into
Like
playing
what?
games, Roblox or Minecraft gift cards, you can win those on the Eddie platform, even Amazon gift cards. We will very soon be offering those. In addition to that, our chatbot will be launched in a few months. And most importantly, we have our virtual care. So that will provide the families with the support they need in case they would like to speak to a pediatric endocrinologist or a nurse practitioner on our platform. That will allow them to do it with a click of a button.
A platform that emphasizes this avatar that you can talk to, it really makes me think about advances in conversational AI and the way that we're starting to be, we're expecting a certain type of conversation, and it's becoming very normalized to have this sort of fluid, natural language conversation. How are the advances in generative conversational AI sort of propelling your industry and what you're doing?
Absolutely. So we're working on incorporating generative AI into Eddie's responses, but we have our own decision-making trees as well. We are using both, and in addition to that, we are using predictive analytics and pattern recognition from all the glucose data and the lifestyle data that we get from the patient all in one place. So the users will have a very enjoyable yet informative time chatting to Eddie.
Nice. Let's talk about traction, kind of how the market has responded. You all already mentioned that you're tied in with Dexcom, so you've got some good partnerships already going through the Dexcom, like CGM, I'm guessing.
Correct.
Other partnerships, other recent traction?
We are in conversation with multiple CGM and insulin pump companies.
Okay.
Also gaming companies. We now are licensed to distribute Roblox gift cards, for example, that we are very excited about. And so we're continuing those conversations. Ultimately, we'd like to have as many integrations on our platform as possible. Okay.
And what are you most excited about? What's coming next in the next maybe 3 to 6 months?
We are launching in Texas next week.
Okay.
We are very excited about that.
What does that mean exactly, launching in Texas?
That means that people who live in Texas, families who live in Texas, can now download the app and use it.
Okay.
Everyone outside of Oklahoma and Texas will be able to sign up to our wait list, and we will give them access through our early access program. And so we're very excited about that. And in addition to that, we are also launching all of our new features and soon to be expanding nationwide.
Very nice. Oklahoma, then Texas. Are you taking a regional approach? Is that where the company's located? What's the idea there?
We have some operations set up in Oklahoma, but really the main reason for us focusing on these states is the rural population, their access to pediatric endocrinologists, and the care that we can provide them.
The need
through
is
our
high.
Virtual care, exactly.
Very interesting, very interesting. Well, Farhana, I appreciate the update. It's exciting to see that you're already achieving this traction. You're a member of our T1D broader community, and it's been great to see that collaboration and see that shared resources. So it's been exciting to see your progress.
Thank you. It's a pleasure to be here.
All right, keep up the great work.
Thanks.
Thanks for listening to Startup Health Now. We'll be back again with another episode next week.